Okay, hello everyone. I'm just going to start my video, so hopefully you might be able to see me at the same time as presenting here today. So today's panel is myself. I am Director of Research Partnerships and Development at MQ Mental Health Research. I've been here now for almost 7 years, which is quite scary. But my role is essentially looking after all our different partnerships across the organisation and kind of seeing the kickoff from inception through to hopefully impact in all our different projects. I also have my own lived experience of anxiety and depression, and so regularly we'll talk about that too. But today, hopefully taking you through in a very interesting way about all the kind of different fellows programs and the opportunity to apply. After I finish going through all the detail, we're really lucky to have Kendall Techstar, who is a business psychologist and a board member for the Mad World Summit and one of our MQ ambassadors. So thank you very much again, Kendall, for being here with us, and looking forward to hearing from you a little bit later on. So in terms of what you can expect from today, we've just done our welcomes and introductions. We're then going to go through in detail the Fellows Award process, the rationale, aims, eligibility, remit, and the award package itself. We'll talk through the application process, the evaluation process, and as I said, have lots of time at the end for questions and answers. We'll also be using this to help generate a kind of FAQ document we'll be posting on the website. So if there's anything that we can't answer today, either due to time or if there's something else we haven't thought of, then we'll make sure to update that and that everyone has access to that. But otherwise, please stay tuned and hopefully more will become clear. So what's probably best to do is start with a little bit of an introduction to who is MQ, and hopefully that means all the rest of what follows will make more sense to all of you. So MQ is a mental health research charity. We are an award-winning and global organisation that have now delivered over $37 million of groundbreaking research through grants and collaborations across 37 countries around the world. So we've primarily done this through fellowships, a program, but also have a number of different kind of functions, as it were. Oh, bear with me, trying to get this to go through. We do this through, as I say, delivering those grant rounds, the fellowships being the key flagship one we'll talk about today, but also through convening consulting with the different sector members, as well as through research partnerships. If you ever have any interest in any of those areas, please do feel free to reach out. But today, as I said, we'll focus particularly on delivering our grant rounds and our fellows call. So in terms of why are we doing this? So the rationale of this year's fellow call really is the same as our kind of overall aims to support advances in mental health research. We really want to support exciting research from the brightest scientists so that together we can make significant breakthroughs in understanding, treating, and ultimately one day preventing mental illness. In terms of a little bit more detail, we don't just want to focus then specific scientific disciplines, but instead really encourage applications from across the scientific spectrum. This is an open call. However, you'll hopefully have seen already in terms of if you've had a look at the website, there are some key kind of areas of interest for us that we'll be really excited to see if you have an idea around this. So those being around children and young people, particularly think about treatment, prevention, including to, but not limited to, anxiety, depression, and ADHD. Also around public mental health, psychosis, bipolar disorder, and suicide treatment and prevention. So whilst, as we've said, this is an open call and it doesn't have to be around one of those areas, those are ones that we know we are particularly interested and we'll look kind of to find more information on. In terms of why we're doing this, I mean, these are ones that we've seen across our mapping through the funding that we've done that are kind of really represent urgent public health concerns and have that significant and kind of unmet need, and therefore where we think there is a potential for substantial impact. So a little bit more about kind of what it is again and why we're doing this. So at MQ, we really are kind of impact-focused funder. Our aim is to support research that is truly going to have a positive impact on people's lives. So that's why we've selected those areas of focus, as I said, because they really do address those critical needs. And again, happy to answer any more questions on why those and a bit more depth or detail on any of them. So a little bit more detail about the award itself and who it's for. So this year, we're really seeking applications from researchers based at US institutions. We're looking to support early career researchers who have made outstanding start to their research career. But most importantly, we're looking for those passionate scientists with bold ideas. So this kind of hopefully keeps it fairly open for you all attending today, but those are the kind of key people that we're looking for, with a specific piece being that you're based in the USA. In terms of eligibility and what that actually breaks down to, so applicants must be in the early stages of their research, so that's 3 to 7 years postdoc postdoctoral experience. Applicants must be based in the USA. Applicants should also demonstrate that potential for establishing independence in their research field. And so those are some of the really key things that we're looking for. In terms of the award package itself, what you would then be awarded if you are successful. So the funding period is up to 36 months. The funding amount is £225,000, and whilst the award is given in pounds, that approximate equivalent value is up to $285,000 in the current exchange rates. And then for more detailed information about what the award covers, you can download the guidance notes, which we'll kind of share a link to in the chat. But this gives you a general idea, i.e. the salary for the applicant, direct research expenses, animal costs, travel and subsistence costs, and training and development costs. In terms of the timeline, there are kind of 3 key parts to the timeline over the next kind of 10 to kind of 11 months. So the first is the kind of expression of interest stage. We want to hear from you about what it is that you're thinking of looking into, and that will help us to be able to kind of shortlist down to those that will invite to full application. That kind of full application stage will be during the summer, opening in July, and then kind of full application by the middle kind of August time. So that's closing at 2 p.m. UK BST, that is. So obviously make aware of what that might be in your location. And then once we've shortlisted again on those full applications, there'll be panel review, peer review, and then interviews held in October. We'll then hopefully be able to award by the end of kind of say October time, make those decisions, and then be kind of starting the contracting sort of period between those kind of last few months before the end of the year, with the aim for research to start at the back end of 2024. In terms of the application process itself, hopefully this is a program that you will be familiar with in terms of we use FlexiGrant, and so you'll need to submit your application using that online management system. As I say, at this first stage, we just need a simple expression of interest, which you will submit also through FlexiGrant. And the details you'll need in that expression of interest are the applicant details, the project overview, scientific abstract, patient and public involvement, and then finally, grants, awards, and publications. Again, all of this information will be available in our guidance notes and on the website. So don't worry about having to note all of this down now. So what can you expect from the assessment process? So these expressions of interest will be reviewed and assessed by the funding panel that we have put together. And then those expressions of interest that pass the first stage will then be invited to submit full application with more detail. The funding committee itself includes international experts, including academic experts from diverse disciplinary backgrounds in the field of mental health science, and of course, people with lived experience themselves. So applications will be assessed on skills and potential of the applicant, on the quality and originality of the proposed project, on the outputs, impact, and dissemination of that project, and then patient and public involvement. So I hope that's given you a bit of a clearer picture about what it is that we're looking for, the really exciting opportunity to be able to apply. As I said, all of this information that we've been through today is available on the website in the guidance notes, and any of your questions today we'll be using kind of to put together our kind of frequently asked question document. But before we go into a kind of Q&A session, I'm going to stop sharing my screen to hand over to Kendall, who's going to talk you through a little bit why kind of she is involved in and kind of the excitement of this new fellows round and being part of MQ. So bear with me while I stop sharing my screen. There we go. Kendall, if you'd like to turn your video on and unmute yourself, we'd love to hear from you.
Thanks, Emily. I appreciate it. It's been a minute since I've been on an MQ live event. I have been an ambassador with lived experience of major depressive episodes and anxiety since 2018. So I actually came across MQ at a Mad World Summit event. If you all haven't heard about Mad World, they are creating forums across the globe now that focus on workplace well-being. So the conversation has shifted massively since I joined the advisory board. Back then it was just really focused on addressing stigma in the workplace. And now we're talking about responsible business. So it's fantastic to see how that agenda has evolved. And meanwhile, MQ is still doing what really drew me to them. So I think the first thing that I was really struck by was not only are we talking about hard-hitting, rigorous research here, leveraging community building, so important. And that's why it's special for me to get involved here. And before I became a business psychologist, which is what I do now, I was actually in mental health myself from an academic perspective. And that was driven from my own experience. Just got really curious about these things, of course. And I do remember how having had that experience changed the kind of researcher I was. So I did a master's in mental health studies at King's College London back in 2015 now. And, you know, from the sensitivity of how I recruited patients to making sure I wasn't treating my SCID interviews, you know, to make sure that people were relevant for our patient population as just something to get through. There are a number of reasons why I think having people with lived experience involved in research is important. You know, it helps to ask the right questions. Are we actually trying to solve the right challenges? What's important for the end user, if you will, or, you know, the people who care for those end users. So MQ will always hold a special place in my heart because I think it is humanizing research in a way that we don't see often enough. And, you know, especially in a socialized medical system here in the UK. So I have a couple of other exciting opportunities coming up with MQ, and one of them is actually going to be being involved in patient and public involvement engagement, so PPIE, and all of MQ's studies now incorporate PPIE, and 96% of grantees reported that it made their research better, and 92% will continue to incorporate PPIE even if it is not a requirement of the funding. So for me, that is going to be the future of what research looks like. And MQ always just seems to be on the front foot here. So I am really thankful for all of the researchers out there who have their heads down. Obviously, you know, affective disorders, major depressive disorder in particular, it gets a lot of, you know, it's in the headlines. So I know there are people working really hard to try to make my lifelong management of this better. One other thing that I want to finish off on, though, is I think MQ also touches on the research that might not see the light of day. You know, these people who have really interesting projects that maybe, you know, the biggest patient population isn't affected by, but something really important or unique, you know, a story that needs to be told for people experiencing those issues. So I'm a huge champion of MQ. It's great to be here today. And if you are thinking about getting involved in any capacity, whether it's becoming an ambassador, donating online, or just keep an eye on the research that's coming out. LinkedIn is a great way to follow. Emily's fantastic about getting content out, so you can hear about all the great things that MQ are up to. And I'll hand back over to you, Emily.
Fantastic. Thank you so much, Kendall. And as always, thank you so much for kind of speaking so openly about your experience and just being such a fantastic champion for us, sitting on both the lived experience and that kind of academic side. So as you see, we've got lots of time now for questions, so please keep putting those through. We've got a few which I'm going to start going through. Kendall is very kind of kindly staying on board for us as well over the next kind of half an hour or so that we've got, and we'll be very happy to answer any questions. So please feel free to also direct any of those to her. So I'm going to kick off, and I've got my lovely team helping kind of sending through questions as they come through, but please, as I say, feel free to kind of stick things into the Q&A section. We'll try and capture if there's anything come through in the chat. And again, if there's anything we don't answer today, please feel free to get in touch with us as well. We can put those into the FAQ document at a later time. But also, as I say, we'll use this as part of our FAQ document if we aren't able to answer today. So one of the first questions we've had through, which is a very good one, about the kind of definition of an early career researcher. So someone has asked, is it a minimum of 3 years postdoctoral required? And if they graduated in 2023, but now in a tenure track position, are they eligible? So we define postdoctoral research experience as any period spent in academic research after successful passing of a PhD or higher research degree examination. So that will be that 3 to 7 years postdoc. So if you spend time away from academic research, for example, maternity leave, sick leave, a break from an academic career, you are still eligible to apply as long as you meet those eligibility criteria. So the time away would not be counted as part of that postdoctoral research experience. I hope that's kind of answered your question. Again, please feel free to have a look through the guidance documents and the FAQ side of things and kind of send through any questions as well. In terms of another question we've received, so that's if NIH, so National Institute of Health, K23 awardees are eligible to apply. Yes, it just means that applicants need to be able to dedicate a certain amount of time to the fellowship. So just making sure that fits with perhaps the demands of that particular award that you've got there. And then applications need to also be accompanied by a statement of support from the head of department from that host institution. So again, we're happy for you to have other awards from different places. It just means you need to make sure that you've kind of thought about that breakdown of the different pieces of work you're working on, and you've got that support from your host institution. We've had another, which is about the window of time the project must be initiated in. So when we showed that timeline, if you remember, we were hoping that projects will be able to start by the kind of back end of this year, or kind of an early start date of, say, 1st of January 2025. However, we can offer some flexibility within that time frame if there are extenuating circumstances. So any applicants who wish to postpone the project start date beyond the 1st of January will just need to request and justify this in their full application. And the request will be considered on the condition that the start date doesn't go beyond May 2025. So hopefully that gives you, again, a bit of an idea in terms of our timelines. Another question here we've had is, does the applicant have to be based at a host institution, and what is the requirement for that host institution? So applicants should be based at that host institution, and the host institution, though, can be a university, a hospital affiliated to universities, or a research institution in the USA. So that gives you kind of diversity there. The proposed host institution does need to ensure that they have adequate and support environment for those applicants, and that is something we will be looking at really closely. Because if it's successful, you and that named institution are expected to explain how the organisation will support that delivery of the project. So we need to make sure you've got that kind of support around you as that researcher, both for your project, but also for the career development side as well, during that grant period that you've outlined in your application. Payments wise as well, those will be made directly to the host institution. So again, we'll need that kind of financial justification as per those kind of terms and conditions of the award. So again, that buy-in from a host institution, whilst it can be university, hospital, or kind of research institution, that buy-in is really, really important. And we look favourably upon those that can show they've got that really supportive institution around them. Having a look through, see if there's any other questions. We've got one about specifying how much the salary can be and if it depends on the institution. The salary will be determined by the host institution. So again, goes back to that needing to have that really good relationship between the applicant and their host institution. And that should include the base salary as well as any additional salary costs, including national insurance, pension contributions, all of that kind of stuff as well. So that has to be fully costed, but again, is a conversation to have with your host institution. Some more on the funding. We've already outlined, I think, in total funding amount per year. So, sorry, is this funding amount per year or the total for those 6 months? So the funding is a total over the grant period, not per year. So that's £225,000, which was, I'm trying to remember how much that was in dollars, about 280,000 in dollars. So yeah, but that's across the whole 36 months of the project to be split across that. How you split across that is then up to you, but if there's more work, for example, in the first part or the latter part, but that's the total for the grant itself. Next question. Also around costs, clarifying the kind of overhead and indirect costs we fund or do not fund, and does that apply to any overhead costs requested by the university? So the institution needs to cover the indirect costs, such as non-specific estimated costs, so estate costs, heating, lighting, office stationery, finance, HR. Those costs are not eligible for the funding from us, even if it's standard practice for those institutions to charge overheads to an external grant. Salary related costs, including benefits, national insurance, pension contributions, are covered, and they do need to be included, as we just kind of said, in terms of part of that overhead kind of total salary costs. So a couple more on the finance side. How precisely do we need to indicate the financial cost? So for instance, would a rough estimate be sufficient? So for that expression of interest aids, yes, that kind of budget needs to be completed kind of in collaboration with the finance team if possible. And at that point, it is a rough estimate of salary costs, direct, other research costs at that stage, but the detailed breakdown isn't needed until that kind of full application stage. So you do need an idea of that and as much detail and kind of as you can, but it can be estimated at that point. And then, as I say, in that kind of full application process, if you're then invited through to that stage, then we'll need much more of a detailed breakdown. Time frames question here. So time frame between submitting the expression of interest and finding out if you've been shortlisted. So if you can remember the timeline, and we can put it up again if that's useful. The expression of interest applications will close on the 10th of May in this year. And then applicants will be notified of the review decision by June 2024. So within a month kind of time that we'll be able to let you know, and that gives you the time to work on the full application. We've got more around that first stage, showing the initial interest in the form. How much detail would you look for? Again, to answer this one's probably best if you go have a look at the full guidance and instructions provided in the application form, and that will give you much more guidance on how best to complete the expression of interest beyond what we've been able to say today. So detail is good, and understanding what it is you're looking for and something that we'll be able to get excited about in terms of the areas that we've outlined. But again, you'll have much more opportunity to put more detail in when it comes to that full application stage if you're invited through to there. In terms of proportion, I've got a question here. What proportion of expression of interest applications are to be chosen to submit to full application? Unfortunately, it's really difficult to know because it really depends on the number of expressions of interest that we get through, and those really can vary. It's kind of impossible to say how many we'll then invite through to submit because it will just depend on that number and how many of those are kind of a really high quality. But it's part of the reason we do an expression of interest stage before inviting through to full application, because if we're going to ask you to spend that time on an application, we make sure that that opportunity cost, as it were, is kind of much more kind of high chance that you'll be able to go through and hopefully receive a grant from MQ. Again, looking at application sides, feedback between outline or kind of EOI stage and full application. So due to that kind of high number of expression of interest applications that we usually get, we are unfortunately not able to provide kind of individual feedback to applicants at that early stage in the process. If your expression of interest application is successful, feedback on your full application will be provided by the MQ research team. But just please do remember that all funding decisions are made by the actual funding committee, and those are final. So I'm afraid we can't offer a say on that really early stage, but if you are invited to submit that kind of full proposal, we will of course be able to kind of make sure we've got that feedback for you. So I've got a question. You've had too much of my voice, I reckon. So I got a question here as well for Kendall. I think. So Kendall, you might be able to answer this one. Again, it's something else that perhaps you and I can answer together. So someone said a big thank you first to you for sharing your lived experience and also your perception of the fellowship. If the applicant also has lived experience of within the kind of mental health construct that they're studying, would you recommend that they discuss that in their application? They've also added typically subjective experiences are kept out of academic writing. So curious to see if we see value in that narrative proposal. So Kendall, I know you've done reviewing for us in the past, looking particularly with that lived experience one. Are you able to come back on camera and unmute for us and just see, kind of give you, and I can add a bit more to that as well?
Sure. I might actually let you start, Emily, because I feel like you'll have like the core answer and then I can build on that. Does that seem fair?
Yeah, no, that's fine. Sorry, throwing you the deep end there. I know you've done reviews for us in one of our fellows rounds before, so I'm interested in your thoughts on this. So I would say yes, we're always interested in that, because for us, and I think this is partly what Kendall kind of touched on, in terms of what we fund, we want to find people who are really passionate about what they're doing. And we know that so often that comes from your own lived experience, be that your own or other researchers or your other friends and family. There's often a kind of a motive that really drives you to be in this space. So anything that helps convey your passion for the space and why, obviously all of that will be treated confidentially. It's just more about showing, your understanding, your excitement about wanting to do something in this area. So yes, if you feel happy to, there is also no pressure to. Many of our researchers do talk about that lived experience, particularly maybe once they've been awarded and then feel happier kind of opening up about it. But it will never obviously ever be used against you. It's more about how on earth is, what is it that makes you excited about this? And if you have got that lived experience, then that's wonderful to hear about. As you've hopefully seen for a day, Kendall and I talk about that very openly, and that's really encouraged, but please also feel like you don't have to. Kendall, do you want to add anything to that from your perspective, both your
I think
slide and MQ?
I'll just bottom line that this is a purpose-driven organization, and the sense of community is really strong. So being academically incisive and all of those things, that's fantastic. But being a real human being who cares about what they're doing and letting that shine through, I think that's what makes this community special. So you'd be quite welcome.
Brilliant. Thank you, Kendall. Again, sorry for throwing you the deep end there.
That's
It's really,
okay.
really useful to hear your kind of view on that. Again, and it's interesting what this person said about, typically they say, don't put that subjective experience in there. For us, we're really interested in hearing that. But again, no pressure at all if you would rather keep that out, particularly at these early stages. And once you feel more comfortable in part of the MQ family, being able to talk about that. I've got a question here. Providing a little detail on the amount of time that needs to be dedicated per year. So we've got full-time, but consideration for flexibility in terms of part-time involvement and experience requirements. I don't know if we need to get more on that in terms of like whether it's 50%. Might come back to you on that one, I think, on the detail on timings. Oh, actually, this is quite a nice one as well to follow on, I think, from what we've just been talking about, a little bit more about patient and public involvement and what that looks like. So aware that it's still in some ways a kind of burgeoning area when it comes to mental health and research more broadly as well, how the health research area is. But it's something that's really important for MQ and therefore the kind of grants that we're making as well. And it can really include anything from the study design, having people with lived experience involved in that, even the kind of putting together of this EOY, and then your full kind of application and the kind of full project design, then being involved in the analysis of the actual project, in the dissemination side. Involving people with lived experience really ensures you're asking the right questions in the first place. And it's a really kind of sensitive way of communicating the findings and kind of in an appropriate language. So we really encourage that kind of involvement and being as creative as you can. There is also various resources as well, which will kind of make sure in the FAQ documents as well, you can go and have a look if it's something that you are new to, both from a UK perspective, but also some US kind of focus pieces. The other key thing as well is that, we really acknowledge that particularly kind of basic neurology, kind of neuroscience end is not a public facing discipline, and that therefore that kind of traditional or kind of, I guess, what we've considered in the past as basic kind of patient and public involvement, i.e., participants being involved in research can be challenging. But therefore, having people involved in that kind of really early stages, those public contributors can be involved in making sure we think about the study design, say that analysis, dissemination side of things, and those resources hopefully will be really helpful. So we're looking for people who are pushing the limits, I guess, in terms of thinking about how they're going to involve people with lived experience. But again, not making sure it's not tokenistic, making sure it's really something that's part of your project. And we see it adding huge value. We see it means that reaching impact is much quicker. And if you've involved those people with lived experience from the beginning, it's much more likely to be used by those people once you get to that stage as well. Right, just having a scan through to see if there are any other questions. So we've got another question around the eligibility side of things. So we've got someone said, if you've got that accumulated at 3 to 7 years by March 2024, through whole-time equivalent research experience, equivalent in nature to postdoctoral research, for example, as a junior PI with 7-year postdoc experience and 2-year PI experience eligible. So we really do aim to offer as much kind of flexibility on kind of on eligibility side of things to support that really diverse range of candidates and attract the best talents. We're unfortunately kind of unable to confirm if the panel will then consider your career pathway as eligible or not. You're welcome to submit an expression of interest and make the case in more detail about what you've just outlined there and the rationale for why you're applying. But unfortunately, it then comes down to that funding panel to make that final decision and kind of looking in total at the different applications that we've had. So apologies, can't give a more certain answer on that, but it isn't a no, don't apply. It's a please, you just might need to kind of think about taking more detail into what you've written there for us and kind of justifying the reason for your application. Right, having a look through if there's any others. Is there a limited submission opportunity or can multiple applicants apply from the same institution? There is no limit on applications from the same institution. So please, if you have other colleagues who might be interested, please also encourage them to apply and share the word. Expectations and requirements reports is a question here. Feedback to MQ, evaluation, following the research fellowship awards. So we've got a kind of regular reporting process which is required. And again, once you're through and we get into kind of contracting stages and all of that will be outlined. We try to make it as unburdensome as possible. But a key part as well is not only being kind of able to show that MQ can see what the impact is and the work that's coming through, be able to be kind of honest about any challenges you might be finding, no cost extensions needed, that kind of thing. It's also really important for us to then use that information to be able to talk about our research that we're funding, to get it out there to the public, disseminate it out there. So again, those reports are really important for all of the different work that we do, and making sure that that research gets out there to the people who need it the most. So the reporting, we say, try to make it as unburdensome as possible, but it's a really key part of the work that we're doing in terms of being able to evaluate what we're doing as an organisation and then getting that information out there. I've got a question here about whether the applicant has to be in the US during the whole assessment and review process. For example, are they still eligible if they have to be out of the country for a few months? Yes, that's absolutely fine. As long as you're based at a US institution, it is absolutely fine if you're traveling regularly. That doesn't kind of exclude you from being able to apply. Got a question on if staff at a university who work in mental health research are eligible, or is it just faculty? Provided you meet that eligibility criteria that we've been through, we welcome applications from anyone. So that's the thing, kind of some of it might just be having to explain or to justify kind of where you are and why you're applying, but as long as you meet those eligibility criteria, then yes, there's no restriction in that side of things. We've got a few more questions. I think there's a couple of questions still on that kind of 3-year postdoc side of things. I think really the same answer. We're kind of aiming to offer as much flexibility as we can, but please just make sure if you are applying to kind of explain that in the EOI and put that kind of case for, well, you know, why it makes sense for you to be applying to this. And again, please do just have a kind of really detailed look through the eligibility criteria that, again, we'll share at the end of this, and that will be on the website with the FAQ documents too. Can cost to fund a PhD student be included? Yes, if it's salary support. So as we kind of said, and this is giving you a bit more detail in terms of what the funding will cover. And again, this will be outlined in the documents. So it can be startup funding for a specific project or transition to funding for a current project. The salary support, say for the applicant or any research staff, for example, a postdoc or a research assistant, sometimes one and the same thing. Direct research costs, that could be research consumables, specialist equipment, for example. You know, in that respect means equipment kind of not in a standard laboratory that's specifically required for this project that you're putting forward. Animal costs, so purchase, importation, housing, maintenance, all of that kind of stuff. And in line with the statements, we use the AMRCs. So that's the kind of Association of Medical Research Charities here in the UK, a statement on use of animals in research, which the link will be for on their website. Travel costs, so that's visits to collaborators, project mentors, attending conferences and the like. Patient and public involvement costs, obviously, as we've explained there, and we would expect any kind of patient or public being involved in this to be compensated for their time. And we go by kind of NIHR rates, which is the National Institute of Health and Care Research in the UK. And then other costs that could be, for example, high costs or items for experiments, e.g. gene expression fees or external internal services, publication costs, that sort of thing as well can be included. We have, you know, when we think about our Fellows Award in particular, it is something that's about really, hopefully, catapulting your career forward and helping you make that jump to independence. So we have wonderful stories, actually, of many of our fellows who've used that funding to be able to essentially set up a team around themselves and be able to support those different PhD students or postdocs and things to kind of, as I say, build that community around them. Often our awards have meant that those people have suddenly started to be able to get kind of more awards themselves, which are then funding their salary costs from elsewhere. And again, that means they can kind of pivot the money they've got from MQ to build in more team members. So there's flexibility along the way as well. It's really about setting you up for success and kind of building that independence around you. Just to say again, in terms of the question we had earlier, the host institution must be in the USA and they must cover those indirect costs, so the overhead costs like non-specific estimated costs, estate costs, laptops, office, stationery, finance and HR. Those are not eligible, even if it's kind of standard practice for your institution to charge those when it comes to external grants. So again, there's lots of flexibility in terms of what it can fund. Hopefully we listed those, they'll be on the website, but just making clear that that host institution is also expected to cover those indirect and kind of overhead costs. Got one more specifically on the kind of topic area. So question is, are you supportive of research that deals with mental health challenges that may not be considered pathological, e.g. climate anxiety, and those that might be best treated outside of the biomedical model, for instance, through psychological support, community care, task shifting, etc., with an eye out for when a person should be triaged to clinical care? Yes, it's the short answer. We take a very broad view of all of this. It just needs to make sure it's around the mental health side of things, making a clear case for how your project is relevant to developing impactful research, and that pathway to impact in particular of how, looking at whatever your project is, how is it going to get to those people who need it most at the end? And then again, coming back to lived experience, how that's really been informed by people with lived experience. So we kind of take a biopsychosocial approach to this. We are really interested in all those different things as long as it goes towards that aim of really hoping to help those people who are impacted by mental illness. If you need a collaborator on the project, for example, a clinical psychologist, are we able to include salary support for them in the proposal? Again, yes. It's all about building that team around you, whatever that team looks like. So yes, as long as it's kind of salary side. A limit for salary, for example, an applicant who holds a lecturer position in the host university, which means it would be a bit higher than postdoctoral research. There's no limit for the salary. However, again, they must be those salaries are determined by your host institution, and also shortlisted applicants are expected to just justify the full application when it comes to the costs and things. So does not rule you out from anything, just that kind of justification, that case for those costs will need to be in that full application. Assessment, will there be any assessment for the selected study during 3 years? Not assessment as such, but reporting is ongoing through those 3 years to kind of check we're on track. Again, we don't want to be this invisible funder. We're very involved and hopefully supportive funder. So please, come to us if there are any questions whilst you are an awardee at MQ. We really want to build that relationship with you rather than just a kind of unknown organization that you report to. So if you have any questions, if there are any bits where things are taking a while, ethics, for example, is taking too long or taking longer than we thought in terms of getting approval, or just recruiting the number of participants you needed is taking longer, it's always better the earlier you speak to us, the better it will be in terms of us thinking out, well, we might be able to support you with any of those things. But also if there's no cost extensions needed, anything like that, please just come and talk to us. And those will be picked up anyway in those regular reports. But again, we have our kind of grants team here who will be able to support you throughout that process. I think I've kind of then answered slightly the flexibility around rebudgeting on the award. So, whilst we kind of offer that flexibility, we expect applicants to be fully committed to delivering their projects as agreed. We understand things come up, things will change over time, hopefully, but there could be a global pandemic again, hopefully not. But all of those things mean we're happy to kind of take them into consideration and see what works. But we want you to come up with your plan and stick to that as much as possible. But we'll look at those kind of extenuating circumstances. And as I've mentioned, some really exciting things that might happen that hopefully, as we've seen with many of our fellows, they're awarded the MQ fellowship that helps to really catapult them, and over those next kind of 2 to 3 years they start getting more awards, which allows them to be creative in terms of how you use their MQ budget to do more than what they thought they might be able to do before. Guidance on the split of time, which should be used, should be devoted to new research versus training, for example. There's no limit or restrictions on that split of time. The onus is really just on the applicant to demonstrate their kind of adequate time commitment to the research and allocate sufficient time and resources for training. So, it's kind of what you need to do in terms of the project itself. So as long as that's being able to be delivered, then that is kind of for the kind of applicant to work out how that time is split. We've had an acronym in here, which I was trying to work out what it is. I'm not sure if the person who put in about NCEs, I'm not sure if you're talking about people who are non-academics, for example, nurses and clinicians, if that is the right thing, because I think we have a different acronym in the UK. Then no, you don't need that. Doesn't just kind of stop you from being able to apply. If anything, we would encourage that and seeing that kind of really interesting cross collaboration across different areas. For that person who put it in, please feel free to correct me if that is not the acronym that you were looking for. But no, as long as you fit that eligibility criteria, as we mentioned, in terms of that 3 to 7 years postdoctoral work, then that still could fit. Doesn't matter kind of almost where you are now. As I say, please correct me if that was not the right acronym that we've got there. So actually that might be no cost extensions instead. Well, hopefully that's an interesting answer for you for the other one. But yes, we do allow for no cost extensions. It will just need to be with kind of extenuating circumstances that is explained and with that justified side of things. But we try to be a really kind of involved and supportive funder. So again, the earlier you tell us about this, the better. And you'll need to kind of submit an actual proper full request that needs to then be kind of approved by us. Oh, just to say on the reporting as well, just for your information, regular reporting, as I said, is required, but it's every 6 months progress report, and the finance report will be submitted. So that's our kind of schedule when it comes to the reporting side. One is, right, here we go. So is the expression of interest stage designed to give you an idea of the total number of applications, or is it a filtering step? In other words, can one not be invited to submit a full application after the expressions of interest reviews? So yes, the expression of interest stage is a shortlisting stage. So applicants will be internally validated. So basically it's just making sure you reach those eligibility criteria and then reviewed and shortlisted based on that assessment criteria. So only shortlisted applicants will be invited to submit a full application. Again, this is partly by the fact that we want to make sure there's a higher chance as possible of you getting awarded before we ask you to take that time to fill in a full application. So yes, it is a shortlisting stage. That means that even if you submitted that expression of interest, it doesn't necessarily mean you'll go through to full application. I think, sorry, I'm just having a look to see if there's any other questions. There's one here, whether your research project can be a significant add-on to an existing study. Essentially, I think it, rather than just think of it as kind of as an add-on, it needs to show that kind of next step or stage of a project. So if you think about your pathway to impact, what is that next big exciting thing that we need to do to be able to take it through to that next stage? So kind of, it might just be a bit of semantics there in terms of add-on versus next step. But if you think about it in that stage, it's not just kind of adding a small extra thing to another study that's already there. But if you said here, you know, it's a significant add-on, it's a kind of thing that you wouldn't be able to do otherwise. It's going to really massively kind of help or kind of add another dimension to that existing study and kind of take it to that next stage. That's the piece that we'll be interested. Again, we'll clarify some of this in the FAQ document. But also one of the key things is, I think, just again, it's about being able to justify this and show the case for it. So it doesn't rule you out, but just make sure you've put really clearly what it is you want to do and why, and then that will be the case that'll be reviewed. Oh, we've got an interesting question here, I think, about co-investigators being included as part of the applicant's research team. So really, no, we're looking for one kind of named principal investigator, that applicant, that fellow. You can have collaborators, you can kind of have, we sort of talked about having, looking like having your team that you would build around you, that sort of thing. So as long as those salaries are in there, then that's great. But we're looking for just one kind of lead applicant, as long as the team kind of salary is covered within that. So hopefully that gives you a bit more kind of clarity on some of that. So in terms of a number of grants we have and how many awards we hope, so we're aiming for at least 4. We hope to be more. We are a publicly funded charity, and so we will be raising money for this over the next kind of 12 months. The more we raise, the more we'll be able to give. So we're hoping for at least 4. And again, there's another reason we do that large expression of interest stage and then kind of filter down a bit. So if we're asking you to fill in more detail in terms of full application, there is more opportunity that you will actually get that award at the end. Are there any recommendations for proposals using translationally relevant animal models? So given applications are coming from the USA, all research just needs to comply with the local and/or national regulations and laws where you are, and meet kind of equal standard established by the following UK guidance documents as well, including animal rights documents. So again, all of that guidance will be on the website for you to have a look through in a little bit more detail. But yes, we do include those, we do look at those, but you just need to show that you're following all of the relevant guidelines and laws and regulations around that area. Oh, got a question here as well. Do you have to be an American or just based in the USA? Just based in the USA. It doesn't matter kind of nationality wise or anything. It's just about you and your host institution are based within the US in terms of your research. Does your grants cover research involving development of technological tools that forward the research goals of the grant? Not sure if I'm completely understanding your question, but in terms of the development of technological tools, I guess if you're asking if you could include that in the budget, then yes, if that's going to kind of make the impact better, if it's going to make it speedier kind of things, then yes. In terms of that budget, we are quite flexible to cover all those different areas we outlined. But again, with all of this, it's just making the case for those different areas of your budget. So that isn't a no, that's a yes, you can include that kind of thing. And again, you just have to make the case for why it's included. This one, clarifying the co-investigator question. So just to say again, there is, yes, only one principal investigator, that is the fellow. The collaborator actually, I think could be, I think from anywhere actually. We'll check the guidance documents in terms of salary. They don't necessarily need to be from your own institution. They could be from others because we are very kind of, we encourage collaboration. But in terms of if you're building a team around you and the staff employed, for example, those postdocs or kind of research assistants that might be there, they would likely then have to be within your own institution. So yeah, co-investigator side of things, as I say, you need your one principal investigator, you can have a collaborator. The other thing we will ask for is having mentors. We can help match you up with those as well, and often having them from a different institution is really encouraged as well. So I think we're getting through, if not have got through, most of the questions that are on here. So we might start bringing this to a close. I'm just gonna have a quick check, see if we've got any others. And then also, of course, you can drop us an email if there's anything else that needs further clarification before you hopefully submit your expression of interest. I don't think there's anything else we need to go through. Kendall, I don't know if you wanted to say anything before we head off. It'd be lovely just to see your face and say thank you again. But otherwise,
thanks, Emily. It's just really exciting to see people expressing interest. Like I said, MQ holds a special place in my heart. You know, I'm 34 years old. I was diagnosed with major depressive disorder when I was 18. And whenever I talk about these things, it's never some sort of victory march. You know, I'm doing an MBA at the moment, and I've had a little depressive wobble, you know, in each season of life. It's like I continue to learn new things and have new challenges. And there, even though, you know, I said depression, anxiety gets a good bit of airtime, there's still so much more that we can do. MQ actually recently asked me to do a write-up, and they said, what research do you wish there had been more of when you were in the thick of it with your mental health issues? And I went on a roller coaster ride with psychotropic medication. I was given every antidepressant under the sun, you know, the half-lives of those medications, 6 weeks on, 6 weeks off. You don't know if your symptoms are from the medication or from how you're feeling. And, you know, that was so chaotic. It was confusing and discouraging. And, you know, to know that one day someone out there will start to crack the code and there will be less of a stab in the dark for people like myself, and someone will be ushered through that experience with more ease, I suppose. I mean, that's what makes this space so important. So I really cannot say thank you enough to everyone out there doing this work, because it changes the lives of people like me every day. So thank you, Emily.
amazing. Well, thank you, Kendall. That was a fantastic place to end, and just such a useful reminder, you know, whether you decide to submit your expression of interest or not, whether you get through to those next stages and whether you become an MQ fellow, A, there'll be more opportunities in the future. So please keep your eyes open for those. But B, please come and be a part of the MQ family. You can sign up to our newsletters as well. We've got a research roundup that goes out with other opportunities, our own and others, in terms of funding, because the work you're doing is just so important, and we are so aware there is just still not enough funding in this space, hence why we exist in the first place. And it's just so important, the work that you're doing. So thank you. And Kendall, you said it absolutely perfectly. You know, this is why we're all here and why we're all kind of involved in this. So thank you both to you, Kendall, for being here and giving up your time. I mean, just today, let alone all the other stuff that you do for us. Thank you everyone for joining us today, and for those who will come and watch this afterwards, if you've managed to stick through to this endpoint, well done. And we really look forward to hearing from you, and please consider an application. We're really excited to see more about your projects. Otherwise, have a lovely rest of your day, wherever you might be in the US or wherever you're watching this right now. It's about almost 4 p.m. in the afternoon here in the UK, so we're almost done for our Mondays. Have a good rest of the week, and we look forward to hearing from you.